on YouTube. Good evening. Dr. Ferrer, you have the floor.
Good evening. I'm Barbara Ferrer, the director of the LA County Department of Public Health, and thanks so much for joining us for this town hall on fentanyl. And muchas gracias a todos por estar con nosotros esta noche. Tonight, I'm joined by Dr. Deborah Eduardo, Superintendent of the LA County Office of Education, Dr. Tsai, the Division Director of the Substance Abuse Prevention and Control Program at Public Health, and Ed Tiernan, a parent and the founder of Song for Charlie, a national-run nonprofit charity that encourages young people to choose healthy coping strategies over self-medication. To start, I want to give you an overview of how we'll run tonight's town hall. We'll begin with some brief remarks from our panelists and then spend the rest of our time answering your questions. As a reminder, you can send your questions in the chat on YouTube, Facebook, or Twitter. As displayed at the top, we also have live translation services during our event tonight. Para escuchar en español, por favor, llamas al 323-776-6996 y apuntas el número 1-77-517-448. Para español. Before we move to opening remarks from our panelists, let me share the most current information about fentanyl in LA County. In Los Angeles County, overdose deaths among teenagers more than doubled from 2019 to 2020. And in 2021, fentanyl was identified in about 77% of adolescent overdose deaths nationally. Recent events involving youth and fentanyl include numerous reports of Los Angeles County adolescents, teenagers, who non-fatally overdosed from MDMA, also known as ecstasy, that had been contaminated with fentanyl going back to May of this year. More recently, in September, a 15-year-old Bernstein High School student tragically was found dead on campus in Hollywood after ingesting a pill containing fentanyl. Since then, there have been at least 7 other reported overdoses among LA County youth, and tragically, some of the young people who overdosed passed away. As Dr. Tsai will talk more in a minute, these recent events illustrate just how treacherous and widespread these overdoses have become. Fentanyl is super dangerous, and it's now routinely being added to so many other drugs and counterfeit pills that are then sold without people knowing that fentanyl was added. So essentially, this is poisoning, as people are ingesting something that they are not intending or wanting to ingest. For decades now, public health practitioners in LA County have been working with community partners in schools to reduce drug experimentation and drug addiction, while building out a network of services and supports for those who need more information and those struggling with substance use disorder. Like many other ailments, there are strategies we can use to educate ourselves, our families, and our communities about the dangers of illicit drugs. Some of the strategies involve making it harder for illicit drugs to make their way into our communities, while other strategies focus on supporting positive youth development and training youth educators. Always, we work with partners to minimize the harms related to abusing drugs and alcohol. A few weeks ago, Public Health sent out an alert to all the district schools with offers of help, including offers to help school districts access Narcan or Naloxone, which is a life-saving drug that can reverse the effects of an opioid poisoning or overdose. We have developed a lot of educational materials, and we're strongly recommending that schools establish peer education opportunities, because we know that students are effective messengers to other students. Over the last few years, Public Health has partnered with schools across the county and with the County Office of Education to establish student well-being centers at 40 high schools, where students are trained to educate and support their peers. It is vitally important for young people to help direct efforts that promote well-being, since they have both experiences and ideas to share about what support would be most helpful. We're also working directly with the hospital emergency rooms and with physicians, recognizing that this is often where individuals show up needing care for a substance use disorder or for an overdose. Ensuring that those who are struggling with an opioid addiction can have easy access to medical addiction treatments and Narcan is a vital part of this work. There are many places where we can make a difference. It will take a collective effort to invest in real prevention and in ensuring easy access to treatment and support. We know that there are many questions from students, parents, and residents struggling with addiction, all who need help connecting with services, support, or respectful treatment. Before I turn this over to our panelists, I hope as we spend this evening learning from each other, we come away from our conversation with a deep commitment to build a system that can promote student well-being, ensure access to treatment and support, and create communities that sustain recovery. We look forward to answering your questions tonight, and now it's my pleasure to introduce Dr. Tsai, who will give some more information about the risks and dangers of fentanyl and how Narcan can help prevent overdoses.
Thank you, Dr. Ferrer. Thank you, everyone, for joining us today. I'm going to provide a little bit of background on fentanyl, what it is, some of the dangers, the risks of buying from unknown sources, as well as providing an overview on what naloxone or Narcan is. Fentanyl is a very high potency opioid that's 50 times more potent than heroin and 100 times more potent than morphine. So a very small amount of it can result in overdose, which typically results from a reduction and eventually a stoppage of breathing within a matter of minutes. Fentanyl can be very cheaply made, and it can also be illicitly manufactured into a colorless and odorless substance. One of the reasons why it's a growing concern is because it's increasingly being illegally manufactured and put into either illicit drugs or counterfeit pills. Things such as MDMA or ecstasy, cocaine, heroin, methamphetamine, and the counterfeit pills can really look like everyday pills that you may find in one's medicine cabinet. All pills that are acquired from places other than a healthcare provider or a pharmacist really should be considered as potentially containing fentanyl. And so that is the very real risk in terms of individuals being exposed to fentanyl, even though they may think that they're taking another medication or another drug. In terms of naloxone, also known as Narcan, it's a life-saving medication that reverses opioid overdoses. In addition to the importance of raising awareness of the risks of fentanyl being found in counterfeit pills and illicit drugs, naloxone or Narcan is also one of our best tools to prevent overdose deaths. A few things that naloxone is and a few things that naloxone are not. Naloxone is an intranasal or a nasal spray and can also be administered via an intramuscular injection. It works by blocking the opioid receptors in the brain and removing the opioid from the receptor that's causing the symptoms of an overdose. It can restore normal breathing of someone who's overdosed within a matter of 1 to 2 minutes generally after it's administered. And doses can be administered every 90 seconds or so, with the effects of naloxone lasting anywhere from 30 to 60 minutes. Because of the high potency of fentanyl, multiple doses of naloxone sometimes are necessary in order to reverse opioid overdoses that are caused by fentanyl. Some of the things that naloxone is not, it's not addictive, it's not an actual opioid. It does not increase the risk of substance use disorders, so it's not habit forming. And if someone has overdosed on something other than an opioid, whether it's alcohol or sedatives, naloxone will not have any substantive effect on them. It would almost be like injecting or having a nasal spray of saline or water. Anyone can actually administer naloxone after watching a relatively short training video. And as with many medications that are administered via nasal spray, similar to cold medicines, it's quite easy to administer. There are also California Good Samaritan laws that protect someone from who's acting in good faith from any civil prosecution if they administer naloxone to someone in an emergency overdose situation. And then lastly, naloxone does not require parental consent. And so hopefully that's some helpful background. Looking forward to further discussion on the fentanyl crisis and what we can do about it.
Thank you so much, Dr. Sy. And now I'm going to turn it over to Dr. Eduardo, the Superintendent of the LA County Office of Education.
Thank you, Dr. Ferrer. You know, we know that schools play a critical role in addressing the issue of substance abuse and the potential for overdose. So we at the county office are working very closely with the Department of Public Health in their Substance Abuse and Prevention and Control Unit, and training all of our schools, providing them with resources and supports so they are aware of what they should do in the event of a potential overdose. We've also partnered with the Department of Mental Health to make sure that we're supporting the overall well-being of our students and ensuring that they have access to mental health services. There are lots of things that schools can do to help prevent this and to protect our students. And one is to prepare in advance for any type of emergency that can take place on a school campus. And that's what's happening with fentanyl. We have a campaign of making sure our districts are aware of this situation, that we are providing education to our students, to parents, to staff, about the risks involved with opioid substance use and overdose and the potential for death, and really making sure they're utilizing resources and toolkits that we're sending out to make sure everyone in the school community, especially students and families, are aware. There's a lot of things that we're doing with our 80 districts. One, as I mentioned, is making sure that there are systems in place so that students have access to mental health services, and not just waiting until there's a problem, but really thinking about preventative care. We're also looking to increase student and school safety by supporting protocols for the use of naloxone, the overdose reversal drug in school settings, and making sure that people are aware of how to access it and how to use it and how to be trained for that. LACO developed a drug overdose mitigation toolkit for schools that has all types of resources for teachers, students, and families on prevention, intervention, and postvention. So we have these information and resources that we're getting out into the community, but we're also reaching out to parents, because we really want to make sure that parents are knowledgeable at the risk that their children can face, that they're having conversations with children that sometimes are not easy conversations to have, but are critical that parents are having these conversations. Glad to be here with all of you. Thank you.
Thank you so much, Dr. Eduardo, for joining us, but more importantly, for your leadership at the LA County Office of Education and all the work you're doing to really make sure that our students have the support and safety that they need. And now it's my deep honor to introduce Mr. Turnin from Song for Charlie. I'm going to let him talk a little bit about his work and his organization and his story, which I hope will again help all of us come together and work harder to keep our children and our young people safe. Thank you very much, Mr. Turnin.
Thank you, Dr. Ferrer, and thank you all very much for having me tonight. Sadly, 29 months ago this week, my family suffered a tragedy. We lost our youngest son, Charlie, to a counterfeit Percocet pill on May 14th. So Charlie was an example of this new category of victim that we're seeing. Charlie essentially, on one level, died from a lack of information. He went online, he trusted a friend, he reached for a pill, a medication that he was familiar with because he'd had back surgery. He'd been prescribed it in the past. And he was seeking some relief from back pain after having driven from Southern California after sheltering in place with us during early COVID and going back up to Northern California for college. And he didn't have any medication, and he went online and got what he was told was a Percocet. Well, sadly, Charlie took that pill in the afternoon, and the doctors tell us he was probably gone within about 15 minutes of putting that pill in his mouth. So Mary and I, my wife, we were struck by the fact when we started doing a little research that we discovered that this had happened to other families, and that there were certain people that were starting to be aware of this problem and who were really concerned about it, like first responders and campus security officers and so forth. Charlie was a senior in college, so he's a little older. And yet we were convinced Charlie didn't know that the pills that were out online or floating around campus or in the locker room and at parties were not real Percocet or Adderall or Oxy. They were counterfeit, the only active ingredient being fentanyl. So we set out on a mission and formed Song for Charlie to inform young people about this new risk, specifically at that time of the counterfeit pills. We've now expanded our scope to include all street drugs, which, as we know, are contaminated with fentanyl. And we try to, our tagline is real talk about fake pills. We try to reach kids and speak in their language. We have a very robust YouTube channel, social media presence. And while schools and other official channels push out information to the kids at schools, we are kind of a cafeteria. We're a resource where anytime kids hear about stuff going on, they can go to our website and our social media sites, our YouTube channel, and they can get really factual, current information there. We really think awareness and knowledge is going to be the key to saving these young lives who are essentially dying because they don't understand the risk. And that's what we're working to change. And we're really pleased to be partnered with you all and thrilled to see what you're doing here. Thank you.
Thank you so much, Mr. Tiernan. And I want to thank everybody who's joined us tonight. We've gotten a whole host of questions in. We're going to do our very best to get to everyone's question. Some people have sent similar questions, so if we don't get to use the exact wording you sent, but something similar, know that we're paying attention and deeply appreciate all of you being with us tonight. Mr. Tiernan, if you don't mind, I am going to start with you because there are a lot of questions about why are these overdoses happening now if fentanyl has been around as a medication for a while. Like, what changed? And I'm going to follow it up with somebody else's question. What should we do, because things have definitely changed? I think it's both. Like, why is it happening now, and what can we really do about it?
Yeah, it's a great question. And keep in mind that this is not my career, that my wife and I have done a deep dive in this issue, and we've spoken to people experts from all areas of the drug conversation in America to try and figure out the answer to that question. What's different? What's changed? And essentially, I think it's this. Drug traffickers have figured out that lab-based chemicals are much more efficient raw materials for producing street drugs. They're very much more profitable than plant-based substances. And we think that's a shift that's never going to go away. This is what we tell young people. This is a change that they're going to have to deal with. And so you've got, for instance, when I was growing up, the warning about drugs was the story of like drug use as a journey or a path, where you would start out maybe experimenting, and as you got a little older, you would maybe settle into an accommodation of which substances you were okay with and which you were not. You might prefer white wine over beer. But most of us move through the experimental stage. We're exposed to different legal and illegal substances, and we come to some kind of equilibrium in our relationship with substances. Now, we all know some percentage of us struggle with addiction and substance use disorder. I myself am 7 years sober, so I know that story very well. And the risk, as it was described to us, has always been that there's a danger that if you do too much or too often, you can become physically addicted or it can be habit. And then one day you're dependent on this substance. And the danger would be that you may one day accidentally take too much and overdose on your drug of choice. And that risk was kind of some years out. The difference now is that fentanyl's been put in counterfeit pills and snuck into other street drugs without the consumer's knowledge. That's the big difference. And so you've got this intersection of fentanyl and fakery, where that's changed the entire dynamic between the seller and the buyer of these street drugs. So anyone, whether you're a police officer or an EMT or a harm reduction advocate working in a safe needle site exchange, everyone knows if people don't know what they're putting in or how much, they're at really, really high risk of overdose. And that's going on every single day today. So what can we do about it? We consulted with a lot of people who talk to young people for a living, our social media partners, our partners in education, and we kind of concluded that we would come in through the side door. We don't lead with the drug conversation. We lead with this kind of this instability, this lack of ability to trust, the idea that you're getting ripped off, the idea that relief you're seeking from a Xanax or an Oxy or a Percocet is not what you're going to get. You know, I tell the kids in my presentations, just like there's no real chicken in a McNugget, there's no real Xanax on Snapchat. None. That's not where you go to get your medications, right? So I think that's the one way we can position it with these young people is you can't solve real problems with fake pills. Your stress and anxiety may be real, but the solution is not on the street because this drug supply has been completely polluted with this really potent opioid.
Yeah, I think that's such a powerful message and really the saddest of all realities, because I think for those who are older, experimentation always carried some risks, but now experimentation is deadly. And it's coming to terms with that. And as you said, making sure that this isn't knowledge that's, belongs to only some people, but that we're really making sure that everyone understands how dangerous these times are. And Dr. Sai, I want to just move to you just sort of on a similar, with a similar thought is, why did it get so much worse during the pandemic? Like what also happened more recently that's really led to skyrocketing numbers in terms of overdoses, and sadly, in overdoses that are resulting in people passing away?
Yeah, that's a great question. Even before the pandemic, we had an opioid epidemic. As we know, the pandemic also injected a significant amount of stress, sorrow, isolation into the lives of many of us. And those stressors oftentimes will translate to different types of coping mechanisms. And one coping mechanism can be substances. And so we have unfortunately seen some increases in terms of overdoses overall throughout the pandemic period. Some of that is also because of the isolation, where there's risk when someone uses drugs in isolation because no one else is around. If there's an overdose, no one can help. And so some of the overdoses has been as a result of that. The other thing that we know is that the opposite of addiction is not necessarily sobriety. The opposite of addiction, many say, is connection, right? When we miss connection, whether it's relationships, school, work, family events, that has a emotional impact on all of us. And we think that that's also driven some of the use. And so there are a lot of different reasons why substance use may have gotten worsened, and I think it's really a multifactorial reason why we're in this situation now.
Thank you so much, Dr. Sai. And Dr. Eduardo, we've gotten a question in from one of our viewers, and I think it's a really important question as well, noting how powerful The conversation has been already led by Mr. Tiernan, and wondering if it's possible for speakers like Mr. Tiernan to be able to go into our schools, particularly our high schools and our middle schools, to talk with young people and to talk with their families about the dangers that, really, fentanyl laced medications, drugs, illicit substances is posing. And I wonder, they're asking if that's possible. So I think there's opportunities to talk both about all the efforts you're already making, but I love this question and really agree with our viewer that it is very powerful, although devastating, to hear the stories of the lives that have been lost or irreparably harmed because of this, poisoning of illicit drugs.
Absolutely. It's heartbreaking when you hear Charlie's story. And there's no question that it would benefit students to actually hear about real life situations that have occurred. And with technology, it's easier to record someone and be able to share that message and get it out to all schools. But what we also want to do is we want to make sure we're not just relying on a recording or one person's story, that we have many, many people trained at school sites that can have these conversations with students. We're also looking at peer-to-peer communication, because oftentimes young people will listen to their peers. So we want to make sure that every school has access to stories, such as Charlie's stories, but that they also have people on their school campus, some of their peers who have been trained to have these conversations, that their teachers are able to engage in these conversations, that these conversations are integrated into lessons and into the curriculum. So these are things that children are learning about on a regular basis, so that we can make sure that they're safe. So we want many, many opportunities for students to hear from their peers, from people who have had these types of experience, and also from other adults on their campuses that they trust and have relationships with.
Thank you so much, Dr. Eduardo. And again, I love the connection to making sure that young people have the ability to teach each other and talk to each other and support each other, because we know certainly for our youth, their social circles are some of the most made up of some of the most important relationships that they have. So I appreciate the emphasis on making sure our schools are able to take advantage of how young people interact with each other. Mr. Tiernan, I'm going to go back to you again. I think, again, from a parent who appreciates hearing from another parent, and wonders how should they talk to their son. They have a son, but I'm sure it could be a daughter. How should they talk to their teenage child about this? They're not sure whether or not their child uses drugs, but they recognize that even in experimenting, there could be a disaster.
Right. And it's a great question. And I think that the big picture is, I hope that as a society, we're going to use this crisis to reimagine the way we talk to our kids about drugs in America. I think we have to expand it. Our advisors, again, the people who talk to young people for a living, said, number one, you've got to be honest with them, that this generation really does learn differently. They've grown up so bombarded by information on their cell phones and on the internet all over the place. And if you're talking to them, they're fact checking you on their phone under the table while you're talking. So you want to be honest, for sure. And I think that there's an opportunity to kind of level set. And it's as we emerge from COVID, I think there really is a big tie-in to the whole mental health question. And I think it's okay to tell our young people, you may be suffering, you may be hurting on certain levels, but it's more important than ever that you find organic, sustainable ways to change your mood. And this is why I love when I hear Dr. Eduardo talk about integrating this into the school curriculum and different subjects, right? We need to be talking about this not just in health class, but in science and in math and in English, and just integrating the message that what you put in your body really does affect you. And in the days of chemical substances floating around the illicit drug supply, it's not a nice to have, it's a critical life skill that you need to develop. You know, we have a couple of things on our website. We call one skills over pills, which is kind of like what you put out, and farm over pharma is about what you put in, right? And our kids need to think about that. What you eat, what you consume on television, has it an effect on your brain? So it's less about a judgment, moralizing, drugs are bad type of thing. It's more of a conversation around the line between medicines, legal, regulated good, and drugs, illegal, scary, bad, has really been blurred now, hasn't it? Because what's happening is kids are dying from what they think are safe and legal medications. So it's a warning to the kids about you need to take care of yourself, but turning to a quick fix solution in a pill bottle is just, you got to take that off the table these days. It's just too risky and we care about you too much. And so let's learn together, you know, how we can find some coping skills. And that's coming, that's all in layman's terms, but that's somewhere in there, there's hopefully a pearl or two.
Yeah, I think it's, again, you know, we're public health people, so we're always looking for prevention. And, you know, we understand the emotional turmoil that drives people towards medications, both legal medications and illegal medications. And we have lots of folks looking for medications to help them manage emotional upheavals, their feelings, their relationships. And you're absolutely right. The lines are really, really blurred. Dr. Sai, you know, again, as a follow-up to that, there's a dozen questions that are very similar, all about how can we make sure that for the people who are using drugs, how would they identify whether or not a drug has been laced with fentanyl? Is there any prevention that we can be offering folks who are using drugs?
Yeah, that's a great question. You know, the best prevention is an awareness of the very real risks that we've talked about in terms of fentanyl being found in drugs and in pills that may look like something else. Essentially, any pills or drugs that are, or any pills that are not acquired from a healthcare provider or pharmacist, very likely, according to the Drug Enforcement Agency, contain fentanyl. For individuals who are using substances who, you know, are wondering if what they're using may have fentanyl, there are fentanyl test strips that can detect fentanyl in drugs. It's important for us to recognize that fentanyl is a synthetic drug, and that there are different types or variants or analogs of fentanyl. And so even with fentanyl test strips, they cannot detect the fentanyl analogs 100% of the time, but they can be helpful in helping to detect the more common variants or analogs of fentanyl. And so that's
maybe you could also just add, because there's questions coming in as you're talking. People want to know, what does it physically look like? Is it a powder, a liquid? You know, what in what form? Like what should they be looking for here?
So I think that the concern with fentanyl is that it can be made into a lot of different substances, pressed into pills. It could look like a powder. So it could really look like a lot of different things depending on where it's being placed in. And if it's being pressed into pills, for example, you know, it's colorless, it's odorless. If they make a pill blue, for example, it may look like any other blue pill. And so it is very difficult to detect if a drug or a pill may contain fentanyl. I mean, you'll see pictures online that have pictures of a real, for example, Xanax pill, and then a counterfeit pill. And I think to most people, they both look like blue pills, right? The markings may be a little bit different. I think the key takeaway message, though, is that any pill that's not acquired from a healthcare provider is at risk for having fentanyl.
I'm just going to stay with you for a second as questions are coming in about your response. Where can people get these test strips? And how, I mean, where can they get them and how do you use them? Because I think there's confusion about if fentanyl can show up in different forms, like how does a test strip actually work? And I want to note what you said, just to be clear. This is not a foolproof strategy at all. So we wouldn't want people to get sort of a false sense of optimism here, that if they're using drugs and they have fentanyl test strips, they're going to be safe, because unfortunately, it doesn't actually work that way. So.
Yeah, absolutely. So typically, fentanyl test strips work by crushing whatever substance someone may be using, whether it's a pill or a drug, and then mixing it with some liquid, and then using the test strip in order to detect if fentanyl is present or not. Importantly, the test strip doesn't let someone know how much fentanyl is in there, or really any other details other than a plus or minus in terms of whether it may be there or not. And then very importantly, if it says that there is no fentanyl, that does not necessarily mean that there's no fentanyl, because there are different types of fentanyl that have slightly different chemical structures that the test strips cannot always detect.
Thank you so much. Dr. Eduardo, we have a few questions that have come in about sort of the resources that are available at schools. I want to just start with sort of the educational materials, the programming that's available at schools and students. I think there's a great question that says, you know, is there a master list? Is there a place for parents to go to find out what materials are available at schools? I want to note there are some parents who have noted that they have received no information that their children are in schools, and they're in middle schools and high schools, and they've received no information. So, you know, that could be that it got distributed, just didn't make its way home, but they're looking, if they want to search out that information, where should they go? And is there some master lists that they could see all of the materials that would be available at schools?
So the best thing for them to go is to their school district's website. And again, schools are in the process of getting trained and receiving all of this information. Went out several weeks ago that we provided a toolkit, and we're in the process of training all 80 of our school districts and providing them with the information and the tools and the kits that they can get out to their students and to their communities. So the best thing to do would be to go on to your school district's website, or to have a conversation with the people at your school and to just simply ask, what type of protocols do you have in place? What types of resources? What types of information? Because every district is different. And so it may be that some districts are more ahead of others, or have more resources than others, or have started sooner than others. But I can tell you that every one of them is concerned, has asked to get information, is participating in the training, and wants to put this information out to their community, because they're concerned about the prevalence of this issue and wanting to take advantage of the tools and resources that are out there. We should also have information on our website at the LA County Office of Education. And I would imagine the Department of Public Health as well has information on their website in terms of resources available for schools. But if you want to know exactly what your school district is doing, your best bet is to speak directly with the school district and ask them what plans they have in place, what systems they have in place, what resources, what tools, what training, and what their plan is to address this issue.
Thank you so much, Dr. Eduardo. Mr. Tiernan, again, I'm going to try to answer as many questions as I can that are coming in. about sort of safety and how to be safe. This is from a person who says, I'm only using drugs occasionally, but now I'm worried that I can get affected. Do you have strategies for people like me?
The sad fact is that the illicit drug market has never been more volatile, unpredictable, or risky. You mentioned people suffering overdoses related to fentanyl who took what they thought was MDMA or was perhaps MDMA that had fentanyl in it, which we know is a thing. Fentanyl has been found in just about every prescription medication you can name. We also know that there have been deaths associated with people taking ecstasy, Molly, that contained fentanyl and passed away from that. And of course, methamphetamine contaminated with fentanyl, and of course, heroin, it's cut in there deliberately. Cocaine contamination is also a very serious thing. So I think one of the things that we think about is how do we tailor our messages to different audiences? If we go back to fentanyl test strips, for instance, we say to young people in high schools, we repeat what Dr. Sai said. These things don't test for every single analog. And by the way, let's do a reality check. If you got that pill on the street or online, I got news for you. It's got fentanyl in it. I mean, you can waste $1 on a test strip, but you're asking a question that's already been answered. It contains fentanyl, and this test strip is not going to tell you how much. So now, if you're talking about a 20-something who's out on the weekend and decides to buy some cocaine, it is a very important and effective harm reduction technique to test that powder substance, dilute some of it and test it before you ingest it with you and your friends, because we've all heard the stories. Fentanyl is an odorless, colorless white powder. It looks just like other drug substances. So either by contamination or deliberately putting it in there, even substances that are cocaine, which is kind of an upper, is also contaminated with this very dangerous opioid. So I wish I had better answers for the kind of weekend warrior, occasional drug user. But the fact is that in this day of very potent chemicals flooding around on the market, it's like a minefield out there. And so you really have to be smart about what you're doing and know what your next step is going to be, or it could be your last step.
Yeah, I appreciate the honesty in that answer. I'm sure it is hard for many people who are using drugs, they consider it recreationally, they consider that it's not a problem, to hear this message. But I appreciate your honesty, because I think it would be misleading at this point for us to say that using illicit drugs doesn't have a much higher risk at this point in time than it's probably ever had before. And people need to know that and make a better decision, so that, as you said, it's not your last act, it's not your last opportunity.
Dr. Ferrer,
Yeah.
can I just to add a couple other strategies? Certainly agree with everything that's been said. For individuals that are using substances, making sure that you have naloxone on hand and that you're around people who have naloxone on hand is important. Not using alone can be important, because as we've discussed earlier, using alone can be risky. And also, considering the amount of use, because, with illicitly manufactured fentanyl, these are not pills that are manufactured in an actual pharmaceutical lab, right? And so there may be times where, whether it's a drug or a counterfeit pill, there's different concentrations of fentanyl located in certain areas of the pill. And so, if we're talking about risk or harm reduction, using less or portions of what someone may be using can also be a helpful approach. But I think the underlying message of any kind of substance use right now exposes someone to tremendous risk because of the fentanyl crisis is really important.
Yeah, I appreciate that, Dr. Sai. I was actually going to come to you, with sort of the understanding that for people who know that they're using and they're going to continue to use, they and their family and their friends all need to understand a little bit more about Narcan, and how to get Narcan, how to keep it in a place where you can then have it to use, or your friends can have it to use as well. And we're going to get into that in a couple of minutes, because we do have a lot of questions about Narcan or naloxone. But I want to try to get through some more of the questions just about fentanyl. So Dr. Sai, I'm gonna stay with you for a second, just because I think this is a really good question. What makes fentanyl or opioids addictive?
You know, opioids, so fentanyl is a type of opioid, and all opioids bind opioid receptors, which are located in different areas of the body, but in particular the brain. And when opioid binds those receptors, it can make people feel on a short-term basis good. Obviously, it can also alleviate pain. And there are individuals who start taking opioids, maybe that they got from their doctor for some kind of pain issue. And then end up taking it for maybe longer than prescribed, and then getting it from other different sources. And so really it's the euphoria or the high that can come from the opioid medication or drug binding the receptor. And over time, opioids are one of the substances where the body can develop tolerance. And so if you have certain predispositions, for example, there may be someone who has a family history of addiction, whether it's for opioids or alcohol. It does increase the risk for all addictions potentially. Someone may be at higher risk if, for example, they come into contact with opioids and then start using it on a more regular basis.
Thanks, Dr. Sai. I'm just going to stay with you for a second on sort of fentanyl. Is the fentanyl on the street any different from the fentanyl that doctors prescribe? And I think we've answered this, but I think you can emphasize, how do drug dealers get hold of fentanyl?
Yeah, so the fentanyl that's found on the street is absolutely different than the fentanyl, for example, that hospitals and doctors offer. The fentanyl that's offered in healthcare settings is manufactured in a pharmaceutical lab with very precise processes for ensuring that there isn't contamination or dangerous substances being mixed in. The fentanyl that's being found on the street is being illicitly manufactured. Sometimes it's in garages, sometimes it's in abandoned buildings, sometimes it's out of buckets. There's a lot of different ways in which the fentanyl is being manufactured. And in speaking with our law enforcement partners, it sounds like fentanyl is actually relatively easy to synthesize or to make. And so drug dealers oftentimes will acquire the materials or the chemicals that's needed, and then follow essentially a recipe to mix it together into fentanyl, and then put it into whatever they may be selling, whether it's illicit drugs or pressing it into counterfeit pills and adding coloring, for example.
Oh, thank you. Thanks so much, Dr. Sai. Dr. Eduardo, we just keep getting more questions about this. So I want to just go back and give you an opportunity to just provide our viewers and listeners with additional information. This, I think, is a good question, noting that, it's one thing to make sure that there are materials available at the schools, but this parent wants to know if you'll be able to offer training for teachers in particular about fentanyl and drug overdoses, what to look for, and how to respond. They are worried that although that they hear that naloxone will be available at many schools, they're worried that nobody will really understand how to use it, and therefore won't be as powerful an antidote as it could be.
Yeah, that's a really good question. So part of the toolkit that we have and the training that we're sharing across the county with all 80 of our districts includes numerous prevention resources specifically for teachers. So they have training videos, they have lessons and activities, they have information about how to integrate it into their curriculum, but it also has information about naloxone and how they can access it, how they can use it, information that we've just talked about in terms of it not being something that could cause damage if used, that it is a life-saving medication that can really absolutely save a life. So all of these trainings that are available are not just being taught a one-time opportunity. They're being recorded. They're being sent out for every district to use. Some of them require, or some districts are taking an approach of the, training of trainers and having multiple people trained to be able to work with teachers. And also, as I mentioned, not just with teachers, but communicating with all school employees, because sometimes a student, it's not going to be the teacher in the classroom. It might be the custodian. It might be the cafeteria worker. So making sure that everybody has this information and that they have the tools in hand to be able to support a student should the need arise.
Thanks so much, Dr. Eduardo. And I think that's reassuring that, it's not just materials, it's training and many opportunities around training. And I don't know, Mr. Ternan, if you want to also chime in about other kinds of training that that folks can access. I want to make sure that everyone knows, just interrupt. You have something to add, please just go ahead, open your mic and talk. So.
I don't have anything to add on that. I'm really excited to hear Dr. Eduardo talk about the peer-to-peer programs that are going in, because one of the messages that we bring to the kids, to the students, is really one of empowerment. And we say, you guys didn't create this problem, but you can own the solution if you want to step up. And we kind of get them engaged and challenge them in this time of kind of confusion and lack of direction and so forth. We say, here's something you can really sink your teeth into. And Dr. Ferrer, you mentioned earlier how strong peer relationships are at this age. We don't talk about, don't let this happen to you. We say, don't let this happen to your friends or anyone you love. Circle the wagons, tell everyone you know, pull together. And so these peer-to-peer programs, I think, are going to be really critical to getting the young people engaged and involved. And that's how we change kind of the social mindset.
Yeah, I think it's again, I think it's an excellent point. And those peer programs have long-term benefits as well. I mean, our young people are really, the next generation of leaders, decision makers, artists, and making sure that we're respectful and allow them to be fully involved, I think makes a huge difference. I'm going to stay with you for a second, Mr. Ternan, if you don't mind, because again, we have a few questions on this topic as well. What is rainbow fentanyl? How do we deal with the fact that we're just about to go into the trick-or-treating season? And so this is from a host of parents that are now worried that although often we target teenagers, that the attraction of rainbow fentanyl might actually, mean that we should be focusing on younger children as well. And even just, sort of, related questions. When do I start talking to my child about this? So I'm going to give all of that entire topic over to you.
Well, it's a great opportunity. It's a great question, and it's a great opportunity to kind of frame this whole issue in a way that I think is really helpful for parents. I think it really helps to understand that this is a business problem. People who are selling these drugs are in it for the money. They want money. They see your students as dollar signs. Now, they don't want to, we get the question all the time, if fentanyl's so potent, why would drug dealers want to kill their customers? It doesn't make any sense. And the fact is they don't want to kill their customers. They would like their customers to keep coming back. And so what they did was, my understanding from our law enforcement partners that we talked to is, I was actually warned about this trend coming like a year ago, where the drug traffickers understand that this generation has a familiarity and a level of comfort with pills. And there's not the stigma around taking a pill that there is around injecting with a needle. And so let's meet that demand. And so they begin pressing these pills using fentanyl as the raw material. And their entry into the market was to say the appetite for these young people is for prescription medications. So we will mimic those. Now, once they establish a foothold in the market, they just diversify their product line. And they say, now we've got a reputation, we have a brand identity in the area of people looking for medications on the street to take the edge off. Now let's expand into the recreational market and make our pills look more like ecstasy for people going to parties or raves or whatever. And what we tell people is, for whatever reason, they've selected this M30 brand as kind of a generic catch-all brand for these fentanyls, is what we've named them. It doesn't matter these days. The message to children, kids needs to be, it doesn't matter these days what color they are. Blues aren't blue anymore. They can be any color. If it has M30, that's fentanyl. Take it to the bank. And you have to be really careful about that substance. Now, let's take the opportunity to do a little bit of myth busting. Most of the people in law enforcement and elsewhere and others say, keep in mind, these people that are selling these substances want to make money. It doesn't make sense for them to drop $40 or $50 pills into Halloween candy bags that are being, that 9-year-olds are carrying around the neighborhood. It's not that, we already know that young children are accidentally coming into contact with these fake pills, and it's a disaster. But I don't think families should cancel Halloween. It's not something that's likely to happen. But there is no doubt that making these pills more colorful and less medicine-y looking is an attempt to expand their market. And that includes teenagers, right? Which is what they're really going after. So there's a little nuance there. But like I said, I wouldn't cancel Halloween, but it's never too young to start talking to your children about medicines and drugs and what you put in and where you get those things. And I say, if the bottle that you get that medicine from doesn't have 2 names on it, yours and your doctor's, don't put it in your mouth. You can't trust it.
I think that's great advice. And I'm just going to add to the sort of Halloween story is, parents, you should be checking your child's candy bag when they get home anyway. And, children shouldn't be really, ingesting any unwrapped gifts that are made. I mean, there will be a whole posting on our website about just caution, really, I think it's common sense cautions around Halloween and around trick-or-treating, and really agree with you. This is not a big threat at all. And as we've all learned over the years, parents need to be careful around Halloween, just for other opportunities that children have to, unfortunately, ingest something that might unintentionally or intentionally cause some harm. I do want to flip a little bit over to Narcan and Naloxone. I'm going to start with you, Dr. Tsai, with just a couple of questions that have come in. Side effects to Narcan, and are there any side effects? And how would somebody, what should you be observing that would let you know it was time to administer Narcan? So I think maybe start with the latter. What would be a reason for going ahead and using Narcan, and then any side effects, anything to worry about?
Yeah, great question. So opioid overdoses typically become fatal when they stop someone's breathing. And so what that will typically look like is someone who may be unconscious. They're not alert. They may look like they're sleepy or sleeping. And they may have skin discoloration. When someone stops breathing, sometimes skin, particularly around the lips, can turn blue. Sometimes they can get a little bit sweaty. but you're really focusing on someone's breathing. The other good thing about naloxone is a couple of good things. Number one, it's very easy to administer because it really is just like almost over-the-counter nasal spray that you can buy at any pharmacy. And so that's why the training for naloxone is not complicated. And that's why so many people, whether you're a teacher or whether you're a doctor or whether you're a plumber, with a very short training, someone can administer naloxone in a very effective way. And the other benefits are, it's difficult to administer it incorrectly because, any amount that gets in the nose will eventually get into the bloodstream and help to address the opioid overdose symptoms. And there are very little side effects. I mean, the side effects that someone sees with naloxone typically are more from the actual reversal of the opioid overdose. And so, that can cause things like muscle cramps, sweating. But, in general, people do not have any kind of serious effect to naloxone. And anytime we administer medications, we consider the benefits and the risks. And so in this situation where, you may come across someone who you don't know if they've overdosed, but clearly they're not doing well. You may find them in the middle of the street. You're not sure if they're breathing. The benefits of naloxone greatly outweigh the risks. And that's why there's things like Good Samaritan laws, for example, in California, where there's a recognition that, the risks are so significantly outweighed by the benefits, which is why, these laws get created to try to promote the use of things like naloxone in order to prevent these really tragic outcomes.
Yeah, I think it's worth, Dr. Sy, just sort of highlighting that, sometimes you come across somebody, they're not really responsive. You're not really sure what they took. And you're sitting there thinking, I've got Narcan, but, is this an opioid overdose or something else? I think it might be important to emphasize why it's okay in that situation to go ahead and use the Narcan.
Yeah, absolutely. I mean, we are amid the worst overdose crisis in both local and US history. And so there will be instances where we come across people, some that we know, others that we don't, who may be unconscious, may not be alert, may not be talking. We don't know exactly what happened. And in those instances, our recommendation is hopefully you have naloxone on hand and to administer the naloxone, because the risks, as we talked about, are so greatly outweighed by the potential benefit, because the potential benefit is to save someone's life. And the risks really is more just, there are no real side effects other than reversing someone's opioid overdose. And so maybe they'll get some muscle cramps, but obviously saving a life greatly outweighs that. And so, I think the calculation is clear in terms of erring towards administering naloxone, and there is no expectation that someone be able to make a diagnosis about what specific substance someone may have overdosed on.
Yeah, I think it's really important to know that if they didn't overdose on an opioid and something else is going on, the naloxone will just have no impact. So, I mean, again, if something else is going on, that's a call, an emergency call to 911, absolutely. And I think it's also important to note and reassure people that you don't get arrested for overdosing and you don't get arrested for administering Narcan. So I think we just, lots of people don't call 911 when they're with a friend who's overdosing because they don't want to get their friend arrested and they don't want to get arrested, and that won't happen. Neither person will get arrested in that situation. So I want to make sure folks know, super important to call 911. Even as you're using Narcan, particularly if it's a situation you're not really sure what's going on, please don't hesitate to get an EMT response, an emergency medical services response. That can only be helpful. It can't be harmful. I want to just go on, Dr. Eduardo, obviously, now that we're talking about Narcan, there are also a lot of questions about some parents are noting, I think because LAUSD was able to, held a big press conference, announced that their program for their schools. I have, parents from dozens of districts who are concerned because they don't think that their districts have access to Narcan or Naloxone, or they don't have any information that their districts are also participating in these programs. I wonder if you could talk a little bit about access to Narcan at the other school districts.
So as I mentioned earlier, all districts have been trained regarding this crisis and how important it is that we're doing everything possible to be prepared and to be able to address and save a student who may have overdosed or taken fentanyl. So they've received the training and they all have access free of charge to be able to obtain the Narcan that they need in order to save lives. It may be that some districts haven't promoted it. Not all districts are as large as LAUSD and have a press conference. It also does require their local board approval. So some of them may be going through that process of getting their local board approval so that they can publicize it and make sure that everyone is aware. But as I mentioned, all of this is the information that they have. They know where to get it. They know how important it is. They know they need to get their board's approval. And I believe that I haven't heard of one district that said they're not going to do this. They all realize the seriousness of it. So again, if you have that concern as a parent, I would talk to your school and ask them where they are at in the process. You can certainly be an advocate and let them know that it's something that you want to see happen. You can ask them about the type of training their teachers and their staff have received, whether or not they have access to Narcan, whether or not their teachers have been trained. And again, you can go to our website. Let me give you that. It's lacoe.edu, where we have all of this information. We have the recorded training. So if you want to say to your school, look, I know this is available, here's the training, and really want to advocate for it. Districts are at different places. Again, there are some districts that are very large and some that are very small and everywhere in between. But I can tell you that our conversations have been very clear that this is a critical situation and that we need to be prepared and ready to address this issue should it arise on one of our campuses.
Dr. Ferrer, can I ask you a question?
Oh, of course.
I'll flip the script on you. I've gotten this question in some of my talks recently, which is, outside of school, if I'm a parent, where can I get naloxone? And what we say to people is that if you entertain teens and young people in your home, you should have Narcan in your medicine cabinet. But there's kind of a run on it, I hear in some circles, because it's in such high demand. So in LA County, where can people go?
Yeah, I think it's a great question. I'm going to ask Dr. Sy to sort of help with the response, but it's sort of ironic because my next question to you was going to be about your advice for parents who are worried that they'll be in a situation and should they be getting Narcan, because we got some questions about that. Can
One of the things that I say, I would love to hear Dr. Sy confirm this, but it's an interesting way because we also hear some parents kind of resist the idea, thinking that, well, Narcan encourages drug use. And it's my understanding, though, the way to respond to that is, I think this is correct, but really naloxone is the only thing that reverses an opioid overdose. So if you are a parent and you fear that there's a kid in your home who's suffering from an opioid overdose and you're doing rescue breathing or CPR, what you're really doing is buying time until the EMTs get there and administer Narcan, right? So, and the faster, the sooner you get Narcan to that potential overdose victim, the better. And so I think it's really imperative for people to just consider it like a critical part of a medicine cabinet. A medicine cabinet without bandages isn't complete, and without Narcan, it's not complete either.
I totally agree with you, and I want to point out a couple of other things. There are some folks who are taking opioids for medicinal purposes. They've been prescribed. And I want to note that the best practice there is for those providers to also issue to those families Narcan, so that there's at least a couple of doses in Narcan at the house all the time, for the very same reason that unanticipated events can happen, and we should all be prepared. And that, we all need second chances, and you don't get a second chance if you die. And so these are in some ways preventable deaths at this point, but we have to be prepared. And I do appreciate what you said, that the advice really to parents is to make sure that you are prepared, particularly if you've got children in your house that are, middle school or, teenagers in college, when there's likely to be experimentation. And I want to point out that we call a lot of what we're seeing with fentanyl overdoses poisoning, so that parents can understand that a choice was not made to use this drug. In many cases, as you eloquently told your story about Charlie, a choice was made to do and use something entirely different, and that the result ended up being disastrous and devastating because it's a poisoning. And again, as with all poisonings, we as parents and adults want to be well prepared to be able to respond. But Dr. Tsai, could you just tell folks that you don't need a prescription to go ahead and be able to purchase Narcan?
Yeah, so great questions. So for individuals who are looking for naloxone or Narcan, whether you're a parent or someone else, you can get it from your doctor. There are also pharmacies with trained pharmacists who can provide naloxone without a doctor's prescription. And so that would be our recommendation, is to speak with your healthcare provider. If you're an organization, whether it's a school or whether it's a nonprofit, there are also other avenues to acquire naloxone, kind of in greater bulk. There's a state grant called the Naloxone Distribution Project that offers naloxone free of charge. There are also various nonprofits available, and we have this information available on our safemedla.org website for individuals who are interested. In terms of the availability of naloxone, we really recommend that everyone carry it. Similar to how epinephrine pens are fairly common for people who may be experiencing serious allergic reactions, or AED devices, automated external defibrillator devices. We can see they're at malls, they're at other places to help address when people's hearts may have stopped, whether it's a heart attack or otherwise. Having as much naloxone available in the community is really important. It's an important tool for us to address the overdose epidemic. And I've certainly heard the same things that Mr. Turner mentioned about concern about naloxone contributing to people perhaps using substances more. And there is no evidence to support that. And similar to what Dr. Ferrer already mentioned, the immediate risk with an opioid overdose is that someone's going to stop breathing and die. And so, that really is what takes precedent in terms of addressing the immediate life-saving need, which is why we think that naloxone availability is really important.
Yeah, thank you so much, Dr. Tsai. And I do want to reiterate, the importance of recognizing that as adults, are really one of our primary responsibilities is to take care of young people, both individually and collectively. And we are living through unprecedented times with the threat that fentanyl poses. And there's always been this debate about harm reduction versus, just say no, or abstinence only programs. There's a place for everything. But keeping young people and keeping those with addiction disorders alive has got to be at the top of the list. And I want to note that what Narcan actually does is it stops you from being high. So it's very hard to imagine that Narcan increases, like the availability of Narcan sort of would increase people's use of a drug that they're taking to feel high or to, feel differently, because it actually immediately stops the high. And that's what it reverses, that effect that the opioid has. And most people are paying for that high. So I don't actually think there's a reasonable correlation between where Narcan is now more easily available and people are going to therefore, go ahead and use these drugs more frequently, because everybody would do everything they can to avoid having an opioid overdose, since what the Narcan or Naloxone does is reverses the impact, the effect of that drug. So I don't think that those two are necessarily going to correlate and move together. And we've known for decades now how important it is to make sure we understand. And this is a good segue to what will be the very last portion of our conversation tonight, but to really talk about prevention and treatment. Because I think we have to acknowledge that our primary work is to help all of us, and especially our young people, enjoy emotional well-being. And that means really lives that are free from addiction. And, we have our work to do at the front end here, and we have our work to do to help people recover from their addictions, receive respectful treatment, and then recover. So I do want to switch because we do have some wonderful questions, insightful questions about this as well. And I think I'm going to start with you, Dr. Eduardo, because I know you've been such a champion of making sure that there are services and support for children, particularly as we return to schools after the pandemic and the isolation and the trauma associated with the pandemic. Children had members of their families die, and members of their families get very sick, and they witnessed really the destruction of sort of the loss of economic stability across the board for so many families. So I wonder if you can talk about sort of the prevention strategy in schools that you've really championed all across the districts, so that we really do understand what primary prevention can offer us here.
Thank you, Dr. Ferrer. The message that we're getting across to everyone is that we need to have regular check-ins with our children at every age, checking in, having conversations about how they're doing, what's going on in their lives, how are they feeling, and really making sure that that's part of everything that goes on in a school. While they're learning, it's integrated into the lesson plans, checking in, making sure that their overall well-being is okay, that they have the food that they need, that they have a safe place to live, that they have people around them that care for them, that they know that there are people at their school and in their communities that love them and are there to care for them. But then it's also making sure that we have ways of assessing for risk in children, and making sure that we have school counselors and social workers that are engaging in programs in small groups, in creating safe places for children when they feel anxious or high levels of anxiety, that there are opportunities for them to go to a safe space where they can disconnect for a moment and just talk to someone about what's going on. We have wellness centers throughout our districts with trained professionals. We have partnerships with all kinds of nonprofit organizations, that, as I mentioned, the Department of Mental Health and others that are working together to make sure that children can feel safe, that they feel cared for, and that they know that there are resources and supports available to them. The messaging that's gone across right now to all of our educators is that children cannot learn unless they are emotionally and physically well. So just as important as that academic program is, we need to check in. We need to have prevention programs starting at very early ages so that we identify if a child is struggling or if there's something going on in the home or in the community, and making sure we have partners that can provide support and resources to those families. So it's early identification, intervening when we know there's a problem, and making connections and letting our students know that their mental health and well-being is a top priority in education.
Yeah, I appreciate that focus. And Mr. Turner, I also wanted to go back to you because from the very beginning of this, you spoke of sort of alternatives that need to be offered to our children. And I wonder if you could just talk a little bit more about, in your experience, what some of those alternatives can be, and how we as, a community of caring adults can make our very best efforts so that children actually have those opportunities.
Right. Thank you for the question. And we're learning as we go here, right? So I'm new to this, but I do think that teaching children at an early age about the brain and how the brain works is very, very important to my mind. And so we need to honor our children's natural curiosity, and we need to encourage that. And we need to tell them that you can change your mood. You can have the same chemical and electrical signals go off in your brain in a natural way that happen artificially with these chemicals. And if you learn those skills, you won't need the chemicals. And in fact, in this stressful world where you're being bombarded with information 24/7 online, all over the place, you're stuck in the matrix all the time, it's really important for you to learn how your brain and body works, and to focus on your own wellness and self-care, and to pursue, natural, organic, sustainable skills in that area. This is not like when I was growing up, where meditation and yoga was kind of she nice to have on the commune over there, right? We live in a world now where these are critical survival skills, and I tell parents, we don't teach our kids to swim so they win gold medals. We teach them to swim so they don't drown. And right now, in the environment they're in, they need these skills. How do they keep themselves afloat, mentally, emotionally, physically, in these crazy times? So again, I'm not an expert, but this is kind of the conclusion that I'm coming to, is that there are alternatives. We've kind of created this pill popping quick fix. There's a pill for everything. There's a medicine for everything culture that our kids have grown up in. And I think we need to start turning the tide away from that to more natural answers.
Yeah, I love what you said about learning the skills. I was a high school principal for a few years, and I really felt horrible about the fact that so many students in my school didn't have skills about how to manage their emotions or their relationships. I mean, they somehow nobody had thought that was something that you need to teach. I mean, none of us are born knowing how to reduce stress. None of us are born knowing how to handle angry feelings. we're not born with those skills. Someone has taken time or not been able to take time to teach us a set of skills that helps us really be emotionally well. And I think I love what Dr. Eduardo said as well. I think we have relegated that set of skills to the back burner. And part of it is, I think, what you were just saying so eloquently, Mr. Terman, which is this sort of notion there's a pill for everything. There's a medication for everything. And when in fact, some of it is, we just need to help ourselves and our children and our young people learn a set of skills that helps you reduce stress. I mean, deep breathing, like who would know like what a difference that makes if you're anxious, but it actually works. But if you don't teach it to young people, then they don't know how to use that. So I really appreciated the helpfulness of the suggestions that there are skills that we can learn that can help us when we're not feeling well, and we're anxious or we're depressed. They can help us as well. And some of that may really alleviate the need for us to go looking for a pill or a drink to help change our moods. Which is, really what I think so many people are indeed looking for. I appreciated those suggestions. I want to go back to you, Dr. Tsai, just before we have to close, to talk for a minute about the importance of recognizing substance use disorders and then the correlation with creating appropriate and respectful treatments for folks, and maybe help, because we have a few questions on that. But rather than sort of go through the questions, I think they all really ask us to really describe a little bit better about what is substance use disorder and how do I know if I have it, and where would I go to get some treatment?
Yeah, that's a great question. There are some specific criteria to make a substance use diagnosis. I would say the most important thing, though, is when we find ourselves using substances more or for really important reasons in ways that are not helpful, and when that use impacts important things like relationships, work, school, sometimes it can be hygiene even, when it essentially gets in the way of doing the things that in the past we've enjoyed doing. Those are some of the key signs that someone's substance use may be evolving into something that's more problematic in terms of a substance use disorder. And when that happens, if that happens, speaking with your healthcare provider, and also other resources that are available for publicly funded services, for example, throughout Los Angeles County, is our mobile friendly platform. If you go on any mobile device on the browser to www.recoverla.org, you'll be able to get information about what substance use disorders are, what services are available in the county. You can also directly connect with our 24/7 call center, where we have trained professionals answering the phone to help someone connect with substance use treatment services if that's needed. And so we would really encourage people reaching out, if whether it's them or whether it's people they know may benefit from help, because as we've talked about, I agree, as a psychiatrist, I agree that we have not necessarily trained our kids, our peers, our colleagues on how to take care of themselves. And that's an increasingly important element of life now. Our world is getting faster, more stressful. We have the pandemic. There's a lot of other things that are going on now in the world. And so hopefully those resources are helpful. And I think we're happy to address any additional questions there are. If you want to go to our substance abuse prevention and control website.
Yeah, Dr. Sy, could you just repeat the website where folks can get 24/7, they can make a call, get 24/7 response?
Yeah, so the mobile-friendly applications, www.recoverla.org. And if you go on the browser on any mobile device, it looks like an app. And so you'll be able to interact with it as an app. Our 24/7 call line for those who may not have a smart device, the phone number for that is 844-804-7500. That is our substance abuse service helpline. They can help to connect you to substance use treatment services across the county, in addition to you speaking with your health provider if that's your preference as well.
Yeah, thanks so much. And just before we close, I'm just going to go back first to Dr. Eduardo and then just ask everyone, last thoughts, last messages before we're going to run out of time here.
Again, I think we need to really be aware of how serious the situation is and that it's going to require all of us working together, schools, nonprofits, county departments, and especially parents, and making sure that we're having those conversations with our children, our children's friends, making sure that we're connecting with them and really being vigilant in terms of what they're doing, who they're with, how they spend their time, and really having these honest, close conversations about this crisis and how important it is that they need to be safe. Thank you.
Thank you so much. Mr. Tiernan?
Right. Well, we'll do our small part as a nonprofit, kind of independent and nimble. We're trying to stay as current as we can and put out information that's useful to young people. We post twice a week on Snapchat, TikTok, Instagram. We have a YouTube channel. Our motto is kind of, we say just say no, but we spell it KNOW. We think knowledge is just so important right now, and that if we can just get the kids to understand what's going on, not all of them, but a good number of them will make better decisions about their health and choose these other options we've been talking about over self-medication. And so songforcharlie.org is where you can find us. Check out our YouTube channel, and our stuff is there all the time. Whenever the kids want to go and get it, they can just grab it.
Thanks so much for joining us tonight. Dr. Sy, I'm going to let you have the last word before we say goodnight, and thank everybody for being with us. We really appreciate that you took time to join us tonight. And, please know, as Dr. Sy said, that we're here for you, and you can reach us again 24/7 with your questions and concerns.
Yeah, thanks, Dr. Ferrer. Yeah, thanks everyone for joining tonight. A couple key takeaways that I think is really important for us to have discussions about with our kids, our families, our friends. Right now, fentanyl can be found everywhere, whether it's a counterfeit pill or whether it's in illicit drugs, and one use can be deadly. And so I think having conversations about that, knowing that naloxone can reverse opioid overdoses and fentanyl overdoses, and having that on hand is really important. So have that conversation with your healthcare provider or your pharmacist about getting naloxone. I think it's just important for us to be aware of the risks and really appreciate those who spent their time tonight learning about that with us, and to everyone who contributed to the discussion.
Thank you so much, everyone, and we'll say goodnight. I appreciate our panelists. They were awesome, and I myself am struck by how lucky we are here in LA County to have so many wonderful people like Mr. Tiernan, Dr. Eduardo, Dr. Sy, helping us really find a path forward that keeps us all safe. So good night, and thank you everyone for joining us.